Welcome to Fit Food Junkies, addicted to health. My name is Emily E., and I'm a certified group fitness instructor and personal trainer. We will not only talk about fitness and nutrition, but also explore how to build a strong mindset, have ultimate motivation, and how to live life to its fullest. Let's start on our health and fitness journey together. Curious to learn behind the scenes about COVID-19? Well, today I am interviewing Dr. Mark Eckstein. He is a nationally recognized leader with over 30 years of experience in EMS. As a medical director and commander of the Los Angeles Fire Department EMS Bureau, he created and implemented many innovative and life-saving programs in Los Angeles, including the brand new 911 dispatch system, a mobile integrated health unit, placed advanced providers in the field, and a telemedicine program. Dr. Eckstein is also a professor of emergency medicine at the Keck School of Medicine of the University of Southern California. He has published over 170 peer-reviewed journal articles and abstracts, has lectured around the world on EMS, emergency medicine, and disaster medicine, and is a recipient of numerous awards, including EMS Medical Director of the Year and EMS Innovator of the Year. He has a master's degree in public health with a concentration in homeland security. He was deputized by Mayor Eric Garcetti as a physician leader of the COVID-19 testing for the city of Los Angeles. Lately, you may have seen him on CNN, World News Tonight, and many other networks. I am so excited to be able to present to you Dr. Mark Eckstein, who also happens to be my dad. Hi, Dad.
How are you?
Thank you so much for being with me here today. And even though he's my dad, you would think, he would have time to do this podcast. Let me tell you, he's a busy man, and it was hard for him to schedule me. So thank you, really.
It's my pleasure.
So we have a couple questions. Today, we are going to be talking all about COVID-19. And just to reiterate, you are the physician leader of COVID-19 in the city of Los Angeles. And as you were deputized by Mayor Eric Garcetti, you have called testing a Herculean effort. Can you please explain how testing works, what is the procedure behind it, and also what your day-to-day looks like behind testing?
Well, for the city of Los Angeles to undertake testing was indeed a Herculean effort because the city does not have a public health department, unlike the county. So Mayor Garcetti decided that he wanted as many Angelenos tested as possible. He appointed me as a physician leader along with Deputy Mayor of Public Safety. And our marching orders were to develop a testing process and then develop priorities downstream. So we had no infrastructure, no public health department, no clinics, no hospitals, no nurses, no nothing.
Wow.
This is typically a job for the county. The county was not able at the time to undertake this task. So we had to determine how we could execute this challenge, this directive. This was back in mid-March, and it was very difficult to get adequate number of test kits. And there were many weak links in the chain, and we know the strength of a chain is limited by its weakest link. Mm-hmm. So you had to get test kits, and you have to have machines and labs to run the tests, and you have to have the swabs. And the swabs look like elongated Q-tips, mm-hmm. and you would think, well, that's the easy part, but that wasn't quite the case. These are special thin cotton swabs, basically, that also retain the virus. And truth is stranger than fiction, but the majority of swabs made around the world were actually manufactured in a town in northern Italy, which was the epicenter of the COVID outbreak.
Wow.
So as you might imagine, that factory was shut down. So there was a worldwide shortage of these swabs. The only other manufacturer in the United States was a fairly small factory in a small town in Maine. So their ability to ramp up production was extremely difficult, as you might imagine. I think the entire state of Maine is probably 500,000 people. So this was not something they could easily execute. At the time also, the major lab companies in the country, like Quest Diagnostics, which is the number one lab testing company in the United States, as you might imagine, the demand outstripped the supply. And most of these labs run a handful of specimens a day, and all of a sudden they had to flip a switch and run hundreds of thousands of specimens a day.
Wow.
So everybody in every city and county around America and every hospital wanted, to run their tests, and we were competing with everybody else. So we were able to get a few hundred of these test kits from Quest with the swabs and everything else downstream. We only have a handful of nurses in the city that work for employee health. We pulled them from those jobs and had them do testing. We got them personal protective equipment with the support of the Los Angeles Fire Department. We set up the whole logistics, and we prioritized the most important symptomatic workers in the city, which are first responders, so firefighters, paramedics, and law enforcement, and healthcare providers who were symptomatic, which at the time meant fever with flu symptoms, cough, shortness of breath, fatigue, muscle aches. And as we know, COVID initially presents like the flu. So we wanted to get the critical workers tested first. And as you might imagine, the initial workflow was very slow initially. And also the labs had very limited capacity. So the turnaround time to get the results was running over a week.
A week?
A week. So if somebody is a frontline worker, like a first responder or a nurse or a doctor, and they have a fever and they want to see if they have COVID, and they want to see if they have to be quarantined at home, they don't want to endanger their patients or their family members, a week turnaround time was unacceptable. And on top of that, we had to get these nurses back to their primary job, which was employee health, because we don't have a public health department.
Oh my gosh.
So literally had to scour the internet to see what other options were available. And
this all happened the second you were appointed to this position.
Literally in the first couple of days. We just sat around a conference room and kind of brainstormed.
I mean, and I saw you, if anyone knows, I saw you working around the clock. It was including weekends, 24/7, really. I know the second 6 a.m. hit. How many calls did you get, right?
Yeah, it was nonstop. But again, there was no playbook to follow.
Right.
I mean, we have a playbook for hurricanes and brush fires and earthquakes and now terrorism.
And this is just so unprecedented.
Right. We don't have a playbook for a pandemic.
Right.
The last major pandemic in this country was 100 years ago.
Spanish flu.
So, 1918. So there's no playbook for this. So this is uncharted territory for everybody.
Right.
So,
and also the coronavirus. So can you just explain a little bit about it? Because it has existed, just not this strain, correct? And I actually learned this, by the way, on watching one of his interviews on the news the other day. So he doesn't share this at home during dinner, but he'll share it on the news.
It's like you have to stand by and watch the commercial to see what happens, see if the butler did it, so to speak. So that's the hook. But yeah, you're right. So coronavirus has been around for many years. It's often the cause of the common cold.
Right.
The difference is this is a different strain that heretofore had never been seen, at least amongst human beings. So what made this so frightening was because it was never seen amongst humans. It was seen in bats and some other animals, but there was, again, no medical literature in terms of how contagious it was, what was the primary symptoms, what's the case fatality rate. And most importantly, there was no known treatment and no vaccine. So all those unknowns made this for a extremely scary situation with a lot more questions than answers.
Right.
And then to exacerbate the situation is we know the initial outbreak was in Wuhan province, China. And it's pretty clear the Chinese government has been less than transparent from the get-go in terms of the facts about this, the origins, the case fatality rate, how many people died. They still, to this date, have never let experts from the CDC in to investigate. So we didn't have a lot of information. And also, when you have a pandemic like this threatening the world and the world's economy, there's a lot of politics and geopolitics play into it. And initially, the WHO, which is the World Health Organization, downplayed this, and early on in late January said this poses no threat to humans. This is much ado about nothing.
Wow.
It's not going to go anywhere. And there's been all kinds of allegations of concern that they had quite a bit of funding from China, so they were incredibly biased. So lots of politics involved. It's easy for the armchair pundits, which is everyone sitting at home, to look at the politicians and say, he got it right, she got it wrong, and so forth. But it's all 20/20 hindsight.
Exactly.
It's easy to say, hey, let's shut down the world economy, let's shut the country down, have everybody hunker down in their home, and let this thing blow over and minimize morbidity and mortality. The problem is the economy's shut down, no one's earning any income.
Right.
And then you have a breakdown of society, you have depression, you have suicide, you have drug abuse, you have alcoholism,
Right.
Domestic violence. So it's not easy decisions. So testing became extremely important to try to determine how widespread was COVID-19 amongst the general population. We rolled out that testing and we learned a lot and got better at it each day. Obviously, as I mentioned, our initial lab partner, the turnaround time was way too long because they were inundated with requests. Looked online for some other options, and it was literally the Wild West. It's safe to say I've learned a lot more about virology testing than I ever cared to know about. I'm an emergency physician, and so I order tests and interpret them and then treat based on the results. I don't run the tests.
Right.
So PCR versus ELISA versus lateral flow immunoassays and VTMs versus saline and
I'm lost a
high
little bit
complexity
here.
labs and
Just a
NP
little
versus
lost.
OP swabs and oral swabs.
So overwhelming.
This was kind of a vertical learning curve. We found a startup company that purported to have swabs that were easier to perform, that were actually self-swabs. It was supposed to be as accurate or as sensitive as the nasal swab. It didn't have to be refrigerated. The lab was actually in LA County, so turnaround times were easy. We'd have to put them on a plane.
What was the turnaround time?
Initially, it was about 24 to 36 hours.
Big difference from a week.
Yeah. Of course, it's gotten a little longer as we've ramped up testing, but
And how
within
many,
a few days.
How many people are you testing a day?
Now we're testing about 10,000 a day.
10,000 a day. And you have how many sites in LA?
So just in the city of LA, we currently have 6 sites strategically located. And these are all drive-up sites. And we're facilitating testing for the homeless, for the shelters, and nursing homes, a skilled nursing facility, which we know are the also hotbeds of COVID-19 because they have a highly vulnerable population.
So if someone wants to get tested and they might not have symptoms, they just want to know if they're positive or negative, do you suggest they go get tested, and can they go get tested?
So that's a good question. So as of last week, as under the mayor's direction, testing now is open to all Angelenos, whether symptomatic or not, free of charge.
And do you suggest that people go get tested? And also, how accurate is this testing? If they're positive or if they're negative, is it 100%?
So great question. There's virtually no tests in medicine that are 100%. Most of these are all PCR tests. PCR stands for polymerase chain reaction. And what these tests do, basically, they get a sample of the virus, they spin it down. The virus basically is just RNA, which is similar to DNA, just genetic material. And they try to amplify the amount of genetic material and see if they could detect it in an assay in a lab. That's basically what PCR testing is. The concern is false negatives, meaning you have the virus, you're contagious, but the test doesn't detect it. This is very similar to the test we've used for years for influenza, the flu. Someone is high risk, they come into the ER with flu symptoms, and they're high risk, meaning there's someone who should be treated with antivirals because they're elderly or have significant medical problems. And we do the nasal swab for them, and we run it in a similar machine we run these tests on. Those are 70 to 80% sensitive. So the false negative rate can be as high as 20 to 30%, no matter which of these tests you use. So what
Will you repeat that percentage again? The false negative rate?
For any of these tests that you run, irrespective of what methodology, nasal, oral, self-swab, different labs, the sensitivity of these is between 70 to 80%. That means for every 10 people you test, you may miss 2 to 3. That for every 10 you say are negative, 2 to 3 may actually be positive, and you miss them.
So you can be said that you're negative, even though you have a chance of being positive.
Right. And of course, that's why we tell people who test who are symptomatic, they still need to quarantine for 7 days plus 3 days from the onset of symptoms with no fever, without any Tylenol. And they have to be particularly vigilant if they come in contact with vulnerable people. So obviously, if they're a healthcare worker, first responder, they live with elderly family members or family members with significant medical problems, because those people are really at risk. So none of these tests, no matter what company you go with, what lab,
it's going to be 100%.
None of us 100%, just like with the flu tests.
Right.
So we've been doing nasal swabs for the flu for years, and it says on there, it's not 100%.
Right.
Treat the patient symptomatically. It's a clinical decision. So the test is a tool, but it's not absolute.
So interesting. And you would think as his daughter that I would have gotten tested, but I actually haven't. Thank God I'm feeling great, have no symptoms, and I've been quarantining. But I have a question. So in terms of thinking if you're going to get tested or not, which population is the most vulnerable, and should they be getting tested?
So it's been very clear that COVID-19, which stands for coronavirus ID'd in 2019, by the way.
And yeah, I asked you this before. I thought it came out in 2020, but nope, came out in 2019.
It was December 2019.
Little did we know.
Indeed. Because coronavirus, again, could be a coronavirus causing the common cold. So COVID-19 is most dangerous for elderly individuals. So the case fatality rate for individuals who get COVID-19 who are over age 80 is probably 10 to 15%, which is incredibly high.
Wow.
Case fatality rate for people over 65 is high. It's probably 5 to 10% or even higher. And the case fatality rate for people who have chronic medical problems. So if you have a history of diabetes, hypertension, heart disease, cardiovascular disease, or obesity, you are much, much more likely to get sick enough to require hospitalization. And the sickest population to get hospitalized require ventilatory support, meaning they can't breathe on their own. They have to be put on a ventilator. So think about it. If 100 people get put on ventilators with COVID-19, only about 10 will survive.
That's frightening. Not only that, but it sounds like a lot of these diseases can be so prevented, right?
Well, that's that's why there was such a concern in this country about running out of ventilators, that would doctors have to make the unthinkable ethical decision to determine who lives and who dies if I only have 2 ventilators. Who's the odd person out?
Right.
But you make a good point in that this is an opportunity for the American population to get healthier.
Right.
When this whole thing is said and done, we know the rate of obesity amongst American adults is huge. It's probably 40%.
And for children, it's almost 19%.
It's frightening. So Americans have become very sedentary. They have high sugar diets. A lot of people live on fast food.
Right.
So if you think about when someone gets COVID-19 and the organs that primarily is attacked is the lungs. And if you're obese, you are much more likely with any lung disease, any infection of a lung, whether it's COVID, pneumonia, your complication rate and your rate of respiratory failure and death is exponentially higher. So perhaps one of the things we could learn and improve upon as a society is finally do something about the growing rate of obesity in this country, which gets worse year after year. And we know most cases of adult onset diabetes are secondary to obesity.
Right.
And many cases of hypertension are related to obesity.
Right.
And many cases of heart disease are related to all the above.
Right.
So we've done a good job decreasing smoking.
But what about...
But obesity and diabetes and heart disease and cardiovascular disease, hypertension are all related, and those are all controllable risk factors, meaning you're not born with those types of things.
And a lot of times they turn into comorbidities, right?
Well, they become significant comorbidities, and they make you highly vulnerable that if you get COVID, to end up needing hospitalization or requiring ICU care or not surviving. The case fatality rate for people under age 40 who are otherwise healthy is exceedingly low. Now, the reason why this number has changed almost on a daily basis is simple math. The case fatality rate is how many people died. It's a numerator versus the denominator, how many people have the disease. Well, common sense would dictate the more people I test, I'm going to identify more cases of the disease.
Right.
So as the denominator gets bigger and bigger, the case fatality rate is going to go down.
Right.
Because out of 350 million Americans, we're not going to test everyone. We have no idea how many people actually have COVID. People may have had a mild flu and they had COVID-19 and never got tested. We never knew. So
same with the flu numbers, right? About 3 years ago, didn't you tell me that the rates were actually higher?
Correct. So on any given year, seasonal influenza, which runs over the winter months, kills about 25 to 30,000 Americans every year. We had a particularly rough flu season in winter of 2017 to 2018, where CDC estimates 85,000 Americans died from influenza.
And how many have died so far today from COVID?
COVID, about 65,000, and the latest modeling projects it'll probably be between 85 to 1,000 to 100,000. So
in the United States.
Right. So it may be similar in terms of mortality, total mortality, to the influenza 3 years ago when you shut the economy down. And most people didn't even hear about that. So, but again, the case fatality rate gets lower and lower because as we're testing more and more
people,
Americans,
that
ratio changes. But the literature, the data is extremely clear that common sense, social distancing, and be aware if if you may expose vulnerable people goes a long way. But again, if you're otherwise healthy, under age 40, and again, we see these tragic cases on the news. We see infants, children, well-known people who are healthy and fit, who've gotten COVID. Some of them were the first patients,
right?
And they've died, or they're on ventilators, or they've had to have limbs amputated. I mean, just horrific,
right?
And the reason those get so much media attention is because there aren't that many of them.
Well, also, you're at a higher risk, even if you are young and you think you're invincible. Maybe if you have diabetes, if you have pre-existing condition, if you are obese, overweight, that is a big risk factor too. Even though you're young, it doesn't take you out of the picture. Well,
absolutely. But if you think about it, we know that the population that's been decimated the most is the nursing home population, which makes sense because it's they're basically living in close quarters, and they're debilitated. They have multiple medical problems. They're elderly, so it's run rampant through nursing homes. And you don't hear a lot about those individual stories. But we tend to hear about young people who die of COVID because there aren't that many of them. They're obviously beyond tragic because, again, these are young, previously healthy people. But just like with influenza, there are people who die of flu every year. It's not that common. But again, if you're young and otherwise healthy, your likelihood of getting sick enough to require hospitalization or worse is exceedingly low.
Right.
Exceedingly low. But we know we have to protect vulnerable people, people with weakened immune systems, and the other groups we mentioned, the elderly or people with those comorbidities.
And that means so basically it means everyone needs to protect themselves in order to protect others. And that's also by going back to those health factors to enhance your health is to stay active, right? And what are some ways people can do that to really prevent diabetes, obesity, and just, going into those risk factors?
Well, and that's kind of the irony here is that whether it's a new bug like COVID-19 or SARS or anything else, maintaining good health
number one for
is
everything.
The best preventive medicine,
right?
By far. Keeping your weight down, walking. You don't have to work out every day. I'm always in a hurry, and I see people wait to take an elevator down one flight of stairs, and these are young people that don't have a disability. I just shake my head. Really? You can't walk down one flight of stairs?
Yeah.
So, and then they come back for lunch
things in life
with a Frappuccino with 1,000 calories. Common sense goes a long way to stay healthy, right? I mean, how many Americans' lives have been saved by stopping smoking? But these are all related. Heart attacks, strokes, diabetes, hypertension, all these risk factors for COVID are also risk factors for any other type of medical badness.
For all ages.
Of course. So when you see kids now getting adult onset diabetes,
It breaks my heart.
you see
yeah.
8-year-olds over, well over 100 pounds routinely. And the kids are living on fast food and sugar drinks, and they're in front of a video screen all day long. Maybe this was a wake-up call, because if 40 or 50% of the American adults are obese, that's going to come back to bite us. And COVID is just one example.
You think it's not COVID, it's going to be something else. Yeah.
That's exactly right. It's going to be something else.
That hit. That is a wake-up call right there.
Absolutely. And in terms of my personal opinion with, some of the distancing and the shutdowns, probably the one I disagree with the most, which
I know what you're going to say,
is closing colleges. So millennials, I'll call college students millennials, 18 to 21-year-olds, their chance of getting sick enough with COVID to require hospitalization or ventilator or dying, is there a risk? Yeah, but it is infinitesimal. It is probably well less than maybe 1 in 10,000. I mean, it's exceedingly low.
So the population that's least likely to get the disease, and now they're...
Well, they can get the disease, least likely
to
succumb to the disease or have serious complications. And they're all on college campuses cohabitating.
With so many germs are coming home to populations that are vulnerable.
Well, worse than that. So it's twofold. Number one, they could develop herd immunity because they could pass COVID around to each other like they do the flu and everything else and build up immunity.
Right.
And very, very, very few would be sick enough to require hospitalization or worse. And you bring them home, and what's the average age of a college parent? 50s, 60s, and some live with their grandparents. So now you bring home these healthy millennials who are almost bulletproof, and then you expose them to older people, and of course compromise their education and everything else. I just thought that was really short-sighted, personally.
Yeah. I couldn't agree more. Yeah.
Doesn't make any sense.
Wow.
Doesn't make any sense. Obviously, if the professors, it would have been easy for professors who are older to shield them with plexiglass or something, or wear masks in class.
Or maybe substitute just for those.
But to bring all those kids home from all over the country, from their dorms, to move back in with their older parents or grandparents, it's just really short-sighted.
Wow.
There's no way to know how the result was. But for example, why was Italy so devastated compared to other countries?
Isn't a majority of the population, they're older, right?
Right. So almost 1 out of every 4 Italians are over 65. In this country, it's about 14%. So almost half. So almost double in Italy. It's an older population. And a cultural thing, many, many more Italians have multi-generational households. So kids live with their parents, adult kids live with their parents and their grandparents. They don't put them in nursing homes. Cultural thing, which is great. But now you have these kids coming home who have flu symptoms, had COVID, that do fine.
Coming
but their
into a household
grandparents
with a vulnerable population
were just devastated. It'd be like taking millennials and moving them into nursing homes. And all the people who work in nursing homes brought the disease in there. So I wonder
how this happened.
So the efforts to me would have made more sense to protect people we know or who are vulnerable. Hopefully, some common sense will prevail.
Right.
But I think some of the takeaways, though, just globally we touched on, is things we know that are good for your overall health. Mental health is part of it. Stress is a big contributor to lowering the immune system. But maintaining a normal body weight, regular, reasonable exercise, a reasonably healthy diet, which will then decrease your chance of diabetes and hypertension and heart disease, and obviously not smoking. That includes anything, and not vaping. your chance of living a healthy, long life goes up exponentially. And
For you and for others.
right, and the chance of getting really sick or worse from COVID or any other bug that comes down the pipe, your chances go way down. So it's globally effective to be healthy, no matter what new bug we encounter downstream.
I actually studied health promotion and disease prevention in college at USC, and I learned in every class how important this is, and global health. So important to be able to enhance your health each and every day for yourself and for others. So love that you say that. Maybe it's not COVID, maybe it's something else that you can prevent yourself from getting. So I know I keep on hearing on the news, serology testing. You're talking about serology testing. Serology testing, if you don't know, it is also called antibody testing. So how is this antibody testing going to be implemented now, and how is that going to help people getting back into work? Is the curve flattening? When are we going to be able to live our daily life regularly again is the number one question.
Well, the flattening of the curve is the number of cases and fatalities going down. The number of cases have gone up because we're testing more people.
Right.
I think the social distancing largely has worked. Not surprisingly, why was New York City most impacted?
Because it's a metropolitan city. Everyone's close, compacted on a subway. In LA, everyone's mostly in a car and a little more separated.
Yeah, it comes down to density.
Right.
Right. It's packed. And subway cars are petri dishes. People are packed.
Right.
What you hold on to there is never cleaned. So it's not surprising. But serology testing, when you test for antibodies, also is an evolving science. So there are two types of antibodies. The IgM antibody is produced in the acute phase of disease, but that could take 10 days or more. Some maybe even take weeks after you have the disease, like COVID, till you develop those acute phase antibodies.
So it's basically a test seeing if you've been exposed to the disease, because if you have been, your immune system is healthy enough to fight it hopefully again, right?
You could be in that phase where you've been exposed, you're shedding the virus, but you haven't mounted an immunity yet. So you could be in that window.
Okay.
So it could take 10 to 30 days to get the acute phase antibodies, which is the IgM. And then the long-term immunity, which takes months to develop, is the IgG antibody. Problem is, no one is certain that if you have either of those antibodies, that you are protected and you can't get COVID again. That's the
throwing something else out there.
Yeah, so that's number one concern. The other thing is there are dozens of these tests on the market. Some involve finger stick for blood. Others involve the typical venipuncture, which is a blood draw they get for a typical test.
So instead of the race to space, it's like the race to find the right testing cure, right?
Well, of course. And these companies, most of these tests have not been properly vetted by the FDA. And the problem is, if the test, now the PCR test, you worry about false negatives. Here, with the serology, you worry about false positives. So if you get a blood test for COVID and it says, yeah, you have antibodies, you think, okay, I'm bulletproof.
I can go out, I can see.
Aside from the fact we don't know, we're not certain if you're immune.
Right.
What if you had the antibodies, but it was for the coronavirus that caused the common cold and not COVID?
That's complicated.
Right? So we're worried about false positives, which give you a false sense of security. So you have to really look and see which have these tests been vetted and what is their specificity, which is false positive. The PCR test for presence of the virus, checking for sensitivity, which you're worried about false negatives.
So what does the future look like? Are you going to be using these tests to getting people to go back into work?
Well, that's the concept of passport immunity, meaning you have antibodies to the COVID. It's like a passport immunity. You can go back to work, that you're immune. We don't know yet. That's the problem.
So every time people say, when can I go back, live my daily life? No one knows.
Well, I think it's a combination of politics and public health. Because the longer the economy is shut down, the longer it's going to take to recover.
Correct.
So if people go long enough where they can't pay their bills and enough businesses fail and people can't pay their rent, the dominoes start to fall in society. So you have to weigh the risk of that with the risk of a secondary surge of cases if now you start opening up commerce. And that's a very difficult decision to make.
Do you think it's going to be in the near future?
I certainly hope so. I think we're already seeing some states and cities start to open up.
Starting to open up. If anything, little by little, right?
Yeah, you're not going to flip a switch, though, and go back to normal. So I don't think we'll be seeing 50,000 people sitting at Dodger Stadium in 2 weeks. I can tell you that much.
But maybe restaurants starting to open up.
Maybe restaurants,
the beaches.
but maybe every other table will have to be open.
Right.
Concerts is going to be different. It's a lot of the airlines have said now that their passengers have to wear a mask,
Right.
which is not fun for flight for many hours.
But in something that is optimistic is I remember you told me when 9/11 happened, everyone thought no one would ever go to large public events again, concerts, be in open settings. And, it eventually went back to normalcy. So it's possible, and it's going to go back to normal.
Yeah,
but it's going to take time.
Reality is people want to, people are social. We're a gregarious species, right?
Right.
And people have been isolated just with social media. I call it anti-social media.
Very true.
The more people on social media, the more isolated they feel, but people need to get together and get out and socialize. But obviously the holy grail here is an effective vaccine, right? So we know there are many companies in many countries that are feverishly working, probably a bad pun, feverishly, but maybe fervently working on vaccines, both for philanthropic means and because it'll be a gold mine. But once there's an effective vaccine, that changes everything.
It changes everything.
And of course, the other question is the anti-vaxxers of the world who refuse to get their kids vaccinated for measles and the flu shot.
Will they use this vaccine is a real question.
Right. And I'll leave you with one last statistic that may shock your listeners. 65% of Americans didn't bother to get a flu shot this year. And I said 25 to 35,000 Americans died this year from the flu. 85.
And it doesn't prevent you, though.
Well, it lessens your chance of dying from the flu.
Right.
So if more than half Americans didn't bother to get a flu shot, when a vaccine comes out for COVID, are people going to not avail themselves of that vaccine as well? So interesting question. The fact that majority of Americans didn't bother to get a flu shot is just frightening.
Wow. That's interesting. And if you're listening and you didn't get the flu shot, I did get it this last year, but there were many years where I didn't get it. And now I don't think I'll go a year without getting it after this crisis.
So I work in the ER. I'm an emergency physician. We're not allowed to work in the ER unless we get a flu shot, or else we have to wear a mask in the ER at all times, which nobody wants to do. Of course, that was pre-COVID. Now we'll probably need a shot and wear a mask.
Right. That's really interesting. Wow, so my brain is just on fire and loaded with so much useful information, and I'm so excited to be learning so much at the same time. My last and final question for you. Here at Fit Food Junkies, our slogan, our motto is addicted to health. So I have a question to you, Dad or Dr. Eckstein. What are you addicted to?
Well, I think I adopt that mantra works for me. It's try to have a healthy balance of family and work, exercise, and a healthy diet. I work out at least 5 or 6 days a week. That's really important.
And he's a busy man. Let me tell you, he makes time for it.
It's really important.
Sorry to interrupt you. The number one thing you told me growing up, you make time for what you want to make time for. And that sticks to me each and every day.
That's very true. People have time to be on social media or playing video games, even 30 minutes a day of some exercise. And I'm at a point now where if I don't get some exercise in, I'm highly stressed.
Right.
So, I don't eat fried food and I exercise every day. And, the bottom line is every day you're vertical is a gift. And if you're vertical and gainfully employed, it's a double gift.
Yeah.
So there's, really simple steps, addicted to health. It's easy to maximize your chances of health. I mean, people get afflicted with diseases and get cancer, and it's no fault of their own, by and large. But we talked about obesity and everything that leads to downstream and how much higher the fatality rate is for people who are obese. That study was just published out of New York, that the data was absolutely striking. So there's an opportunity for hopefully the American population to get healthier, because again, you don't need to go crazy. But again, it's taking the steps instead of an elevator. Having a more balanced diet. I mean, things people have been talking about for years.
Right.
It's not that hard.
It's more evident than ever.
That's correct.
Well, thank you so much, Dad, seriously, for taking the time out of your crazy schedule. And yes, even we're talking on the weekend, and yes, it is still crazy on the weekend. So I can't thank you enough for making time for myself and my listeners, and your sage advice, your wisdom, and I just love picking your brain each and every day. It's really an honor.
Well, it's been my pleasure.
Thank you so much. And thank you for everyone who listened today. I hope you find this extremely useful during this unprecedented crisis, which will soon be over in no time. Thank you so much, Dad.
You're very welcome.
Well, that was a wealth of information, and I hope you learned as much as I did during this interview. I think this truly highlights why we need to focus on healthy living each and every day as a vital tool for disease prevention. If we're not already connected, join me on Instagram at FitFoodJunkies and on my website, fitfoodjunkies.com. I'm so excited for you to join the Fit Food Junkies journey with me.